Hello friends, the surgical periodontal pocket therapy is one of the most important components of complete periodontal treatment. It includes two kinds of procedures. One are called as the pocket elimination procedures and the other one are called as the pocket reduction or the maintenance procedures. Now the pocket reduction or the maintenance procedures, they include the most commonly done flap surgeries, that is the modified Whitman flap and the modified flap operation. Now the modified flap operation was introduced by Kirkland in 1931. Now this is one of the most conservative procedure which preserves the healthy tissue because it aims only at removal of the pocket lining. This is why this procedure is done most commonly on the maxillary and mandibular anterior areas because they are of prime aesthetic concern. So now let us see how a modified flap operation is done.
So we have a patient here with chronic generalized periodontitis with moderate to deep pockets. So first of all, we irrigate the area with antimicrobial solution, and then we isolate this area with the help of gauze. Then we start with the incision. In the posterior areas we use blade 12D, and we go from the sulcus till the bone, and in the anterior areas we can use 15C blade. As you can see that I am putting the incision from the sulcus till the alveolar bone. You have to make sure that the incision is placed right into the sulcus without cutting the flap. So this is how we complete the incision. And in the same way the incision is given on the lingual aspect. In the posterior areas we can use blade 12D, and then we reflect the flap. So first of all we reflect the interdental papillae, and in the same way we reflect the flap on the lingual aspect. It is important to expose the marginal bone so that we can access the bone defects, but overexposure is not recommended. And then we start with the removal of the granulation tissue with the help of curettes. So all the granulation tissue in between the teeth is removed, and as we have complete access to the root surfaces, the root planing is also done. And the same procedure is repeated on the lingual aspect. From all the interdental areas the granulation tissue is removed. And then when we remove the granulation tissue we have to re-inspect the area for any remaining granulation tissue or tissue tags. So all the tissue tags and the granulation tissue is removed. And then we start with the scaling of the teeth. As the root surfaces are clearly accessible to us, so we do the scaling. You can see the calculus particles coming out. The root surfaces are scaled and they are made absolutely clean. The main advantage of modified flap operation is that it preserves maximum healthy tissue, removing only the infected pocket lining. As you can see that scaling is done on the buccal aspect, and the same procedure is repeated on the lingual aspect. And the important step in this flap procedure is the removal of the granulation tissue and tissue tags from the flap. So you will see that from the inner surface of the flap we are removing the granulation tissue and all the tissue tags. With the help of curved scissor or Castroviejo scissor, you can remove the granulation tissue from the inner surface of the flap. The margins of the flap may also be trimmed so that they nicely adapt to the root surfaces. And we have to inspect the bony defect. If there are any bony irregularities or bony protuberances, then we have to do bone reshaping. And the same procedure is repeated on the lingual aspect, removing all the granulation tissue and tissue tags so that our flaps are absolutely neat and clean. Now after completion of this procedure we have to inspect the flap. Now you can see that the area is absolutely neat and clean. The flap margins are well adapting to the interdental area, and there is no remaining granulation tissue, tissue tags or calculus, etc. The same thing is done on the lingual aspect. Inspection is done and seen whether any granulation tissue or tissue tags are remaining. So all these are removed, and then we go ahead with the suturing procedure. I'm putting a continuous link suture here, and this is after suturing. You can see nicely placed sutures and the flap is properly adapting to the tooth surfaces. This is from the lingual aspect, and this is 1 week post operatively. Thank you very much for watching.